guy, I've told this story before, so some of you may have actually heard me say it on television at least. I met this guy a few months ago named James Lowe, 51 years old, 3 years younger than me. I met him early in the morning in the Appalachian Mountains in Virginia. And we were sitting out at a picnic table. And he told me his story. And his story was that he'd been born with a severe cleft palate. And it was so severe that he literally couldn't speak, or no one could understand him when he spoke. And he had no health care coverage, so it was fixable, but he couldn't fix it. And finally someone came along and voluntarily fixed his cleft palate, and now he can talk. Here's the problem. They fixed it when he was 50 years old. James Lowe lived for 5 decades in America, not able to speak because he had no health care coverage. And he was very gracious and humble and grateful that somebody reminded me a lot of the people that I grew up with, actually. And he was very grateful that somebody had finally fixed it. I didn't feel grateful. I felt outraged. I sat there listening to him, and this outrage welled up inside of me thinking, how long are we going to let these people run the government? Really? How long are we going to let insurance companies and drug company profits decide whether James Lowe and other Americans have the health care that they're entitled to? We live in the most powerful, wealthiest nation on the planet. Can we finally say that every man, woman, and child in America should have health care as a matter of right? That's what America should be doing. That's what the President of the United States needs to stand up for. The President needs, listen, the drug companies have got plenty of people taking care of them. I guarantee you that. And the same thing's true of the insurance companies. Who speaks for James Lowe? Who speaks for the members of your family who don't have health care coverage? Who speaks for the members of your family who are terrified that if they change jobs, they're going to lose their health care coverage? Or because they have a child or a spouse or a parent who has a pre-existing condition that they won't be able to cover and insure them again. Americans should not be living like this. We're better than that. The United States of America is better than that. And by the way, these examples go on and on. They go way beyond health care. I mean, they do. Now, let me mention a couple of things about my health care proposal. It actually requires everybody to be covered. It also fills in the cracks in the system, which means we ban pre-existing conditions. They're outlawed as a matter of law. On top of that, mental health is treated the same as physical health. We have real mental health parity. We cover preventive care, chronic care, long-term care, dental care, and vision care. And you can take your health care with you wherever you go. So the idea is everybody's covered all the time. And now, I don't claim my health care plan's free. It's not. It costs $90 to $120 billion a year, but it's paid for by getting rid of Bush's tax cuts for people who make over $200,000 a year, which I think is a better investment. Those are the things that we need to do about health care. But I want to go back to my original thing. You know, when we have a crisis in health care, we have a crisis with global warming, preserving the planet. We have, I believe, a